Hello, everybody. Vice President Kevin Larson from New Earth here. I'm really excited to talk to you about today's healthy hustle. This is an important topic that we're going to be talking about. And I wanted to do something just a little bit different. It's going to be a two-parter. We're going to have another one that follows on next week. But today I wanted to talk to you about something that impacts everyone. Everyone. What is that? Inflammation. I want to talk to you about that word. What is that word? What does that mean? What does that have to do with us? Because, we typically don't talk about, those types of things, but I wanted to come at it from maybe a little bit of a different angle, right? For some of you that are maybe watching and listening to this particular healthy hustle, what is the first thing that you would do? So I'm actually going to switch screens right now, and I'm going to show you how this works, really with most folks. So I'm going to reshare my screen to a different place. And this is where most people start on this question: inflammation, right? They might say, "Oh, well, I've injured my leg in some way, or I've twisted my knee, or, I don't feel great," or there's a million different things. So what do people do when they have health questions nowadays? They don't always go talk to their doctor, which they should. We recommend that, right? They don't go necessarily talk to a practitioner, maybe a naturopath or a chiropractor or things like this, right? What do? They go here to Dr. Google and they say, what is inflammation? Right? That is an interesting question, because look what Dr. Google does with all of this. What is inflammation in the body, of the heart, of the stomach, of the liver, of the bladder, of the lungs, of the brain? Oh my goodness. And then interestingly enough, you've got this one right here. I'm feeling lucky. Well, look at that list. Who's feeling lucky after reading that? Not a lot of us. But what is inflammation, right? What causes it? Where does it come from? How does it happen? And a lot of what we're going to be talking about is maybe defined by the things that you're doing, the life you're living, your age, etc., right? These are just normal processes of our life. And so, we can go to, let's say WebMD. Dr. Google says, talk to WebMD. Isn't that great? Doctors talking to doctors, none of which are actually people. And what might WebMD say about it? Well, several things can cause chronic inflammation, including untreated causes of acute inflammation, such as an infection or an injury or an autoimmune disorder, which involves your immune system mistakenly attacking healthy tissue. Now, this is one definition, right? Long-term exposure to irritants such as industrial chemicals or polluted air. Kind of interesting. What exactly is it, though? Well, Dr. WebMD continues. It's a process by which your body's white blood cells and the things that may protect you from infection from outside invaders such as bacteria and viruses. So inflammation is a natural biological response to some sort of stimulation outside, right? That could be anything from rolling an ankle in basketball, and got to protect that joint, got to make sure it's taken care of, got to protect it, get some, of those healing things that your body naturally does in there, right? On the other side, maybe you have inflammation of the joints, right? Well, same thing. Got to get some of the body's natural processes in there to help resolve these problems, right? This is what inflammation typically does. Some of the inflammation can actually show up in our gut, right? What are the worst foods? Did you know that food can be a type of inflammation, right? So you'll see the American diet often talked about as a bad thing, right? What is the American diet? Hot, brown, lots of it, right? And it needs to be quick and fast. Put it in a bag. I'll take it with me. That's happened a lot during the last little while, right? So what is that typically? Refined carbohydrates, white breads, pastries, French fries, other fried foods, soda, things you don't think about often, other sugar sweetened beverages, red meat like burgers and steaks. Lots of meals have red meat every single time people sit down to eat. That's crazy. And processed meat, things like hot dogs and sausages, or even some of the things that people love, pepperonis that go on pizzas loaded with nitrates and things like this. That can be what inflammation is for you. It could be something that's going on in your gastrointestinal tract, something that you are doing to yourself simply by the lifestyle that you live and how you are taking care of your body. Now, that is alarming, right? That can be a big concern. What do we do, of course, to handle this inflammation that has manifested itself? Well, that's why this is a two-parter. The first thing I want to talk about today has nothing to do with New Earth's products. I want to talk to you a little bit about lifestyle and the things that you can do to avoid inflammation in your life, just handling it through your lifestyle, because a lot of the time you need to stop the source. And like we just said, some of that could simply be your food. And that begins the process of the inflammatory response, right? So when you have things like, different diseases that can afflict your body, right? Your immune system will respond. So things like, difficulty with your joints, or like we mentioned in the gut, or, other processes, other systems, most all, including cellular systems of your body, can experience inflammation. So the trick is to find out what is triggering that inflammation so you can help to reduce it, right? The first thing to do is to decide, is this acute or short-term inflammation? That short-term, if you've rolled your ankle, could still be 3-4 weeks, right? But that's inflammation. Or is it chronic, long-lasting inflammation? Acute inflammation with proper treatment, proper care, maybe some ice, maybe some elevation, maybe some rest, that can go away sometimes in hours, sometimes in days. Chronic inflammation is a totally different story. It can last for months, maybe years, even after decades. You can still have inflammation, and that is potentially even after the first trigger is still gone. It's a cascade of events that can happen. Conditions linked to chronic inflammation are multitude. And, I don't want to get too far into that, but some of the conditions that a lot of people in their lives today have can relate to this. So if you're experiencing things like, joint pain or stiffness, or a joint that just doesn't work like it should, or maybe, fatigue, loss of energy, headaches, loss of appetite, muscle stiffness, these are the kinds of things that could indicate you have some sort of inflammatory response going on in your body. Number one thing to do, consider your diet. What are you eating that could potentially, create inflammation instead of helping to resolve it? More fruits, more vegetables, and enzymes to help break down your food so you can distribute those different byproducts of the food that you're eating, right? You want to make sure that you're getting the nutrients out of your food, particularly if you're eating fruits and vegetables and eating them in a greater quantity, right? Second, hydrate. You can't hydrate. I was going to say you can't hydrate enough. You can, but certainly you need to potentially hydrate more. Why? You're trying to keep things moving, right? You don't want stuff to get stuck. And that's what can happen and trigger and maybe inflame and worsen your inflammatory response. Okay. And you would also assume that, in some cases you should stop, right? Don't move, right? Be completely still and wait for it to go away. Wrong. Even in sports medicine with things like ankles, they encourage you, once you get past that first level of potentially causing an injury, get mobility in there. Move your body more frequently. That is going to help to begin the process of healing for your body. Once again, part of why you're staying hydrated as well. That gets things moving, but you want to get moving so that your body can get things moving as well. You have not just a circulatory system, but you have a lymphatic system that is really one of the delivery systems for your body's immune response and reactionary response. Make sure that you're moving enough to keep that lymph moving through your body. All right. So those are a couple of the things. Now, I mentioned this is just the short intro. It's we're going to have another short piece on the other side. What can you add to your diet that gives your body the nutrients that it needs for you to have a better, fighter's response towards those kinds of things, right? What is your body looking for? What does it need to truly be successful at battling this type of struggle? Because we all have it. So what can we add to our diet? Next time we talk on inflammation, I want to talk about, things that we can add to our diets that will help us be more prepared. I'm not telling you that any of these products cure, treat, prevent diseases at all, including inflammation. Your body does that. The trick is you need to feed your body well. So what I'm really talking about is food. And that's all these other things that I want to talk to you about is food. Turns out ancient foods that are actually really good at this type of thing. So I'm going to have someone along with me in tow for the next session. Stick around, stay close. I want to make sure you get to see it because it is going to be a good conversation. I think it will be beneficial for all of us to be able to see what we can start doing to improve. Thanks a lot. We'll talk to you again soon. See you on the other side.